Joshua F. Tenorio, Segundo Magalohan Guahan, Lieutenant Governor Guam.
Everybody be seated.
Half a day. Wow, for a full room didn't sound like one. Okay, we're going to organize. Half a day. That's more like it, Public Health. Thank you so much for joining us this morning. Welcome to the Office of the Governor of Guam. My name is Crystal Paco Sinagustin. I'm the Director of Communications here at the Office of the Governor of Guam, and I want to welcome you here for a very special proclamation signing. And I say special because this is standing room only now, to proclaim April 2025 as Public Health and Social Services Month. And before we end, actually, we're also going to go outside and view and bless our new public health mobile clinic. So round of applause for that. You're probably looking to your left and your right, and there's a lot of dignitaries in the room, and I'll go ahead and acknowledge them joining us this morning, starting with the Honorable Lourdes A. Leon Guerrero, Governor of Guam. Let's give a round of applause. To our immediate right, we have the Honorable Joshua F. Tenorio, our Lieutenant Governor of Guam. And please indulge me and keep those applause clapping for Director Therese Areola, for Deputy Annette Shelton, and former Senator, of course. Also want to recognize Chief Public Health Officer Catherine Nkau. Our members of the 38th Guam Legislature, led by our Oversight Chair for Health, Senator Sabrina Salas-Matanani, Senator Therese Solani, Senator Jesse Roman, Senator Sabina Perez, Senator Shelley Calvo, and Senator Sean Ratal, who's just awesome for joining us. Let's keep this applause going for our leadership at the Department of Public Health and Social Services, our division administrators for the Division of Environmental Health, team, Division of Public Welfare, thank you so much, Division of Senior Citizens, Division of General Administration, Division of Children's Wellness, and the newest division, the Division of Homelessness Assistance and Poverty Prevention. Also, while we're there at the Division of Homelessness and Poverty Prevention, on his right is Dr. Robert Leon Guerrero, Medical Director for the Department of Public Health and Social Services. I also want to recognize our Community Health Center board members, Mayor Melissa Tavares, former mayor, still forever mayor of Dedigo, Mayor Ellen Ngukta of Ingilao, and Mayor Tony Jargala of Inalohan in the house. Speaking of Community Health Centers, I also want to introduce our new CEO for our Community Health Center, Shermalyn Pineda. Half a day. For the office of Congressman James Moylan, we have his rep, Ralph Scambalori. Thank you so much for joining us. And let's give a blanket round of applause for all the cabinet members from the Leon Guerrero Tenorio administration. Half a day. Keep those applause going. I didn't say to stop. The Guam Community College, the Guam Comprehensive Cancer Coalition, I do see you, former Senator Luis Borja, the Diagnostic Laboratory Services, DLS, we've never had lab work done, FHP Health Center, Total Guam Foundation, Guam Radiology Consultants, MDX Imaging, SCA Clinic, Guam Cancer Care, members of the Guam NCD Consortium, our Breast Friends Forever support group is also joining us. That's the best name ever. And St. Luke's Medical City also joining us. I forgot to mention the Division of Public Health Bureau of Non-Communicable Disease is also joining us. I do see you, Chima, in the back hiding in the corner. Erica's house is also here. John Tyson, Junior Chair for the Guam Diabetes Control Coalition. And I would be remiss if I didn't acknowledge him because he's going to bless our public health mobile clinic. Let's give a round of applause for Monsignor Ruben Espino, Secretary of joining us everything. Now to our program. Thank you so much. I hope your hands are numb from all the clapping. I want to give the floor now to tell us why we're all here today to Director of the Department of Public Health and Social Services. You have the floor, Therese.
Thank you, Crystal. Thank you, Governor, Lieutenant Governor. And thank you, Senators. I'm overwhelmed because it's my first proclamation signing as the Director of Public Health and Social Services. So I'm very overwhelmed of the number of, first of all, my staff, thank you very much. I know it's been a heavy lift since I've been here, lots of changes. I appreciate you very, very much. Partners, thank you so much. Legislature, thank you for your support. But most especially, I need to recognize the man of my life, Vince Ariola. Thank you very much. By the way, these guys on my left are the ones, don't forget to acknowledge Vince. Thank you, partners. Thank you, public health family. I just can't. I'm overwhelmed. I'm overwhelmed because there's a lot of good things coming down our way, and it's all because of you. And so April is, and thank you to a wonderful right hand, my two deputies, Peter John Camacho and former Senator Amanda Shelton. Thank you so much for helping me on the day-to-day. 7 divisions is a large division. Public health is the second largest agency outside the Department of Education. And we touch everyone's lives, whether it's at a restaurant you attend to, your children's school, the community health clinics that you and your family members attend. Our most vulnerable that we help in our homeless division, the newest division, are the help that we give to the Medicaid recipients, the SNAP recipients, the TANF recipients. I mean, public health touches your life in one way or another. And so I just want to say thank you for your support. There's a lot of transformative changes happening in the department. Some of them you know about, some of them they will be unveiled as we go along. And so I just look forward to your continued support. I'm asking the people of Guam to come out and think about how public health really touches your lives, because it really does touch all our lives. Whether you're a direct recipient or not of our services, you know somebody in your family or in your immediate family that is touched by public health in one of the divisions, one way or another. Between our nannies in the division of children's wellness to our most vulnerable Mananku, who we cherish the most. And so public health is your public health. And so thank you so much, because I can't do this alone. Thank you very much.
And I want to give the floor to Senator Sabrina Salas-Metanani, our Oversight Chair for Health. Hafaday, good morning, everyone. Let's be honest, when people outside of this room hear Public Health Awareness Month, they don't exactly start lining up with excitement. It doesn't exactly scream party time. There's no parade, there's no raffle, but maybe there should be. Because public health is the real deal. It is the backbone of our community. And while most people are arguing on Facebook about what they think public health does, your team is actually doing the work. Quietly, behind the scenes, no fanfare, no filters. You're keeping our Medicaid, Medicare, MIP, SNAP programs running so families can get medical care and groceries. You're out in the field, in the office, in the labs, and half the time in 2 places at one time. And this year, you're leveling up, and in a few moments, we'll be unveiling your mobile health clinic. Public Health will now have a clinic on wheels, fully equipped, staffed, and ready to roll into island villages. And you know what that means? No more where do I go or how do I get there, because now public health can come to you. This is not your Uncle Joe's pickup truck with a cooler of Band-Aids. This is real access, real services, and real commitment delivered with horsepower. This mobile health clinic is public health in motion. Literally, it's Guam saying, we see the need and we're not waiting around. We're bringing preventative health care to your doorstep. Now that is the kind of energy we need more of, not just during Public Health Month, but year-round. So to the team at Public Health, thank you for doing the hard work with heart, humor, and hustle. We see you and we appreciate you. Thank you.
Thank you so much, Senator Bree. I now want to give the floor to our governor, registered nurse, Lourdes Leon Guerrero.
Thank you very much, Crystal. I'm a little bit sort of emotional right now, and the reason is this. I have always said from day one, even of my nursing, that public health, as the senator said, is the backbone of healthcare delivery in our island. Public health, as the theme says, starts here. It starts here in the delivery of healthcare. And it's not just healthcare, but social services. Because you see, you have to look at all of that as a total well-being for our people. And the reason I said I'm a little bit emotional is I look around the room here, and these are the same people that we worked with during pandemic, day in and day out, sleepless nights, emotional turmoil, crying with the families that have lost their loved ones because of COVID. And you all stood up with great professionalism, great compassion, great empathy, and love for our people. And you know, we can talk about facilities, we can talk about electronic systems to help improve the care, but I'll tell you, our people in public health are very professional people. The nurses, the doctors, the microbiologists, the physician's assistants, the laboratory people, the surveillance people, the environmental health people who are really only wanting to protect the safety of our island and our people. And we don't give you enough recognition from our community. And it's really unfortunate that only negative things make the headlines. We don't make the headlines saying, hey, public health pushed out millions of dollars to childcare during pandemic. Public health pushed out millions of dollars so that single mothers and fathers who have to work can feel that their children are being taken care of in a very professional, certified, and accredited child care provider. Public health did all that. We don't talk about public health helping in good ways the homeless people. We don't talk about now we're going to have an assisted living operated by public health. We don't talk about the food stamps that we have increased. We don't talk about Medicaid cap that we've increased from $18 million to $133 million today. We don't talk about that. We only talk about the bad things. And I'm just totally, really frustrated about that. So we as a community need to rise up and make sure that we give public health the appreciation that they so love and need. Really. These guys work, like I said, 24 hours, 7 days a week during the pandemic. And we prevented 3,000 lives from dying. And it's you guys. We're preventing drug abuse as much as we can. We're preventing communicable diseases as much as we can. We are nervous today about measles outbreak. Surely,
Therese and I talk every morning. Therese, do we have any measles cases? And we don't. And we need to, as leaders, continue that message out there about the importance of vaccination. The importance of vaccination. So to me, it is not just a month of recognition for public health. It is 365 days a year. Moving forward. And I'll tell you, Josh and I continue to fight for all the resources that public health needs. Josh is out there beating the bushes for centers for our homeless people. He's out there beating the bushes for senior centers, for adult care centers. We're working hard to make those things happen for our people. Why? Because it's us here. We can't really rely for federal government. You see what's happening in federal government right now. It's us that we have to rely on ourselves. And together, I think we know we can do it. We are talented people. And the thing that drives us, I think, and I truly believe, is the love of our people and our island. This is our island. It's us. And so I just want to also give my gratefulness to Therese and her leadership. And of course, former Senator Amanda. Amanda's pushing this assisted living. Believe me, she's out there working hard to get our assisted living done. She's working very hard with the senior citizens. And of course, Peter John. And I want to also thank Melissa and the community health centers, because we're also pushing to make it a standalone community health center. We're doing great things like Teresa said. We're pushing so that when you apply for Medicaid, you can get your card that same day. And we're working hard to make that happen. These are some of the great things that we don't, like the senator said, you guys work behind the scenes to make it happen. And so I just want to say thank you, Therese, and thank you for your team. Thank you for the public health people. And don't let anybody say that you are not the best, because you are the best. I want to thank Senator Sabina for her comments. As you can see, she's going to be very committed to making sure that public health gets the budget. Senator Bree, what did I say? Sabrina. I know, Senator Bree, and there's another Senator Sabina. I'm sorry. I meant Senator Sabrina Bree, who is your oversight chair, who is committed, as she said in her message, to make sure that you guys are given the resources, the help that you need to make your job a success. And I also want to thank the legislature for their commitment and their support in making sure healthcare delivery is the best for our people. Again, thank you, all of you from public health, from the top administrators to the doctors, the nurses, all those professionals, all down to maintenance and housekeepers and so forth. Suzus Masi, and from a very grateful community, thank you for all that you do.
Suzus Masi, Governor. I now want to give the floor to the Honorable Joshua Tenora, Lieutenant Governor of Guam.
Good morning, everybody. I just wanted to I was curious about the crowd. Are there, will the public health employees that have more than 25 years of service, could you raise your hands? Okay. How about between 20 and 25 years? Could you raise your hands? 15 to 20 years? Raise your hand. How about 10 to 15 years? Okay. 5 to 10 years? How How about less than 5 years? Okay, so we have a good mix. You know, when you're looking at organizations, right? You always get concerned if everybody's more than 25 years. Well, we have a crisis, right? And so it looks like there's a good succession track here. I know that there have been lots of challenges. Because really, in these last few years, there's so many things that you were doing with so much of your time that you never did before because of that pandemic. And then on top of that, you know, the government is not a very perfect place, right? You know, constant administrative challenges, payroll, overtime, expiring, you know, so many delays in recruitment. And it's very good to be honest about the kind of challenges that we see, because the only way we can improve is if we know what the challenges are. And I feel that at this point, there is a vision for improvement for the department. And the improvement isn't necessarily on improving the quality of the staff. As the governor and Senator Sabrina said, and the director, we have quality staff. The challenge is making sure we have quality resources and support so that the staff is able to do their job more effectively and get rid of the muddling through the bureaucracy and red tape that sometimes we spend too much of our time with. So the improvements I look at, I know that a whole bunch of you are involved in the technological modernization improvement, which really the outcome we're looking for is how can we get benefits to our consumers in the fastest way possible, right? I think the goal for us, as I understand for SNAP, we want people to be able to apply for SNAP and get their eligibility determination within 1 hour, right? People can't wait for 1 month if they're starving, right? Food is sustenance. Making people have medical crisis, and if they're eligible for Medicaid and need to have serious things happen in acute care, they need to be able to get their Medicaid insurance done very timely. And we know that we've looked, and I see the improvement processes, making sure that we reduce the number of things that are required of patients. Why ask people for documents they don't need when it's in other areas of the government? Especially if they don't have transportation, right? Transportation is such a barrier for people. So I want to recognize the work that you're doing to try and improve things, because in many ways what you're doing is you're giving that additional time in your mind to figure out how to make things better, not only for our consumers, but for the employees, so they have time to really do what they studied or they signed up to public health to do, right? Everybody is applying or working at public health because inherently they want to help people, right? You're not going to be an employee of public health if you don't want to help people. The whole point of public health is helping people, and helping people who are vulnerable or who are experiencing the most vulnerable of times. So today we celebrate your work. We celebrate the important work of public health for the people of Guam, and the elected leadership is here together along with the leaders of your department to celebrate your work and to let you know that we're counting and we're working to make things better for all of you. Viva Public Health.
Thank you so much, Lieutenant Governor. Before we proceed outside for the unveiling and the blessing of our Public Health Mobile Clinic, I want to give the floor to former Mayor of Dededo, Melissa Tavares, for the reading of the proclamation.
Okay, thank you. Governor, I want to thank you for sending Teresa Ariola to Public Health. She pushes a lot to happen, but it's for the good of the people of our entire community.
And willingly went.
Yes. And she, we've taken her to our National Association of Community Health Center conference, and she didn't just come to the one meeting that she was required to come to. She went to all of the breakout sessions that she could, absorb about Medicaid and unsheltered patients. So from one, set of patient care to the next. And she also was was recognized by the National Association of Community Health Care president for being with us. So thank you for allowing her to
come to Department of Public Health. Okay, so proclamation declaring April 25th as Public Health and Social Services Month. Whereas public health and social services professionals champion and the well-being of people and communities by working to help improve their health and by achieving equity across the healthcare system. Whereas ensuring people and communities are safe and healthy is a top priority for the Department of Public Health and Social Services. Whereas the American Public Health Association celebrates National Public Health Week across the United States during the first week of April, Department of Public Health and Social Services is commemorating the importance of public health and social services throughout the month of April. Whereas this year's theme, It Starts Here, celebrates what we know is true. Public health starts with each of us making a difference in our homes and communities. It's how the places we live, work, and play affect our well-being. Whereas the Department of Public Health and Social Services has 7 divisions: Division of General Administration, the Division of Public Health Division of Public Health, Division of Environmental Health, Division of Public Welfare, Division of Senior Citizens, Division of Children's Wellness, and Division of Homelessness Assistance and Poverty Prevention. Whereas the men and women of the Department of Public Health and Social Services work to promote healthier lifestyles, prevent communicable diseases and non-communicable diseases and illnesses, and improve, maintain, and protect the overall well-being of all people and communities. Whereas public health professionals are comprised of doctors, nurses, epidemiologists, microbiologists, medical laboratory technicians, laboratory specialists, environmental health officers, pharmacists, pharmacy technicians, nutritionists, communicable disease coordinators, investigators, health educators, social workers, claims specialists, program coordinators, eligibility specialists, and homemakers who are passionate about their careers and meeting the health and welfare needs of the community that they serve. And whereas Department of Public Health and all public health and social services professionals are duly recognized for the commitment to safeguarding the health and welfare of Guam through acts of service that strengthens communities by promoting healthy lifestyles for all.
Now therefore I, Lourdes Leon Guerrero, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim April 2025 as Public Health and Social Service Month. In doing so, I call upon the people of Guam to recognize and celebrate public health and social service workers for their commitment to a healthier people and safer island.
In witness whereof, I, Joshua F. Tenorio Segundo Magatlaing Guam, Lieutenant Governor of Guam, hereby, together with the Magahaga, cause the Great Seal of Guam to be affixed in the capital village of Hagåtña on this 4th day of April in the year of our Lord, Anno Domini 2025. Viva Public Health and Social Services Month.
Mayor. Thank you so much, Governor, and thank you so much to our Lieutenant Governor. I'm going to ask everyone, please exit the room and go outside to our parking lot for the unveiling and the blessing of our public health mobile clinic. Our blessing will be by Monsignor Ruben Espino. So we're going to proceed outside. This will conclude our live stream event. Again, congratulations to Public Health on Public Health and Social Services Month.